My name is Larissa Domenichelli. I'm from Cloverdale, California, and my connection with pulmonary hypertension is I was diagnosed in November of 2020 after being in heart failure. Little did I know it was about 6 or 7 months, just progressively short of breath, feeling faint. It all started working as a dialysis tech. You have to move, clean those machines, get those patients on and off because you have 3 shifts, 3 different patients 4 times in a 14-hour shift. And I just couldn't move like I used to. I used to play basketball. I was like really good and I just couldn't move like that anymore. And I noticed that's when COVID came out too. And a coworker actually joked with me and said, "Yeah, you have COVID, huh?" And I said, yeah, little did I know my heart was starting to shut down right then and there. As time went on, I got worse and worse. I couldn't even work and I just refused to go to the emergency room because of COVID. I have been in the medical field my whole life and I kind of had in the back of my head, I kind of knew something was going on that was serious, but I refused to go to the emergency room because I did not want to be there alone because that's scary. On November 5th of 2020, when I checked myself into the ER and I heard the nurse saying stat and 3 or 4 people rushing me to EKG and CT and here's the doctor coming in asking me questions, I honestly was in disbelief. I did not believe that I was in heart failure. I'm too young. I'm 37. I don't even have half my life put behind me. When the cardiologist came in and said, "We're going to do a heart cath on you tomorrow," I was in shock. I was like, maybe I should call my mom now and tell her I'm here. They were also going to take me up to ICU. They were going to put a bypass machine on me, which is a machine for breathing, as all us pulmonary hypertension patients know. And that was really scary to me. My O2 sat was 50 when I was admitted. I couldn't even take 10 steps without gasping for air and doubling over and almost fainting. I couldn't do anything myself. So when I went up to ICU, I called my mom. My mom came and was really surprised that I said this nonchalantly, because like I said, I was still in disbelief. I am 37. This is not happening to me right now. Next day, they ended up doing the heart cath. I got out of the hospital like 7 days later. And mind you, I'm on 6 medications for the rest of my life now. The doctor did tell me that it was due to an atrial septa defect, which is a hole in my heart, which makes the oxygen and blood go 2 separate ways, which causes pulmonary hypertension. Basically, there was nothing I could do to prevent it, I guess. So now I see a cardiologist every 3 months. I still have trouble breathing. I just started a new medication, my 6th medication, actually. I can actually walk upstairs now without gasping for air, and I can actually carry things somewhat. Carrying things upstairs is super hard for me. And it really sucks when you're only 37 again and you have to ask for help constantly. After being in the hospital and going through that, I went through a bad breakup and then I got evicted and then it just went downhill from there. But things are starting to look up now. I did get a job in the oncology unit, which makes me grateful for being alive. And my life isn't that bad. It takes a lot to accept it. I never thought in my life I would be at 37, not being able to shoot a basketball, not being able to run down a basketball court, not being able to rebound, not being able to run down the stairs, run after my dog. It really puts a toll on your self-esteem and your dignity and everything. Now I'm still struggling. I still have really high pressure in my lungs. Mind you, when I was in the hospital, my pressure in my lungs was 88 and a normal person is supposed to be 12. My pressure in my lungs right now is 84. The cardiologist is still working on getting my lungs down. I'm trying to get in to see a pulmonologist. Here in California, it's really hard to get in to see a pulmonologist because there's not too many of them that specialize in that field. And I've also researched it a lot, which I don't know if is a good thing because the life expectancy and stuff to tell you online was really scary. After being diagnosed, what really makes me think a lot is why we're here for such a short amount of time. Like, what is the point of that? And I'm still trying to figure that out. I don't know. I mean, I guess because I won't live as long as I would have before I found out I had this, I guess you could say. Because I am Italian and, we live forever, they say. It's just been really crazy. I have taken up this art called paint pouring and I do tiles. I make spoon plates and coasters with my free time because I don't work full time because I get too tired. When I get too tired, then I'm gasping for air. My oxygen's low. I get a headache. It's just a domino effect. And also being 37, having to take 6 medications a day is just not fun. I didn't think I would be 73 at 37. Like I said, I'm still accepting it. I'm trying to accept it. It's been really hard. Not being able to breathe is really scary, when you're gasping for air after you've been walking only, down the stairs and people are looking at you like, what's wrong? And you're like, just give me a second, I'm just trying to catch my breath here. And you almost feel like you're going to pass out, but you don't want to tell them that because you don't want to scare them. The medication is super important. My doctor said I probably won't have to do IV infusions right now, which I work in an infusion center. One side's oncology, one side's infusion. So I see this. I see these patients. I see how it works, the whole process. And it's a part-time job for those people. You know, they're there sometimes 3 times a week. I definitely don't want to have infusions. My doctor talked about a double lung transplant and a heart transplant. I don't even know if I would even think about that. That's such a huge thing, because I've seen patients with kidney transplants and it's like their world has just begun. Like they didn't want to put me under anesthesia all the way when I was in the hospital, and my pressure is almost that high again. I don't want to attempt even anything like that. It's just scary. I would rather give the transplant up and let a child go. You know, I'm not saying that I deserve to die, but I'm saying my lungs are already, you know, whatever. And if a child is there, then they deserve it. I think that, because I can't have kids now because of this last prescription that I've started. I had to actually have a surgical procedure, my tubes tied, and I can't have children now. I have kind of accepted it, but I would want a child to, you know, have a wonderful life instead of have to worry about what I have to worry about. It's not fun. Some days are worse than others, but I couldn't imagine being a child going through it. I couldn't. My job, those patients ring the bell every day, those cancer patients. You know, I'm not saying I'm going to be cured, but I know I'll be able to get better by taking better care of myself, which it's in and out, you know, no salt. And then again, sometimes you can't exercise like you want. And that's how I take my anger, my stress. I run, or I used to do kickboxing. There's no way. One day I'll be able to do it again, I think. It's just baby steps, you know? It really is baby steps, especially when you're dealing with the lungs. To young people, I would say if they had any symptoms, I would go to the doctor right away. I wouldn't have waited 6 or 7 months. No way. If I had to do it over again, no way. I mean, maybe they could have not cured it, but maybe I could be on 4 medications instead of 6. I don't know. You know, woulda, shoulda, coulda. And I would just say, young people, just take care of yourself. Exercise is really important, because I would have spouts after high school. I wouldn't exercise for, you know, months at a time. And they say sitting is the new smoking. So that's super bad for you. My name is Larissa Domenichelli, and I'm aware that I am rare.